Hello and welcome. I'm Stefan Crisell, an acupuncturist with the Chanda Center for Health. And this is the fourth video that I've done this month in order to help support everyone through this time of not being able to provide services. So I hope you've had an opportunity to check out my videos as well as videos that have been done by some of the other practitioners, giving you some ideas of some good self-care strategies and how we can best support ourselves during this period of time. So for my talks, I started on the 8th and on the 22nd. Those 2 Wednesdays, the focus was primarily on nutrition and lifestyle medicine management. On the 22nd, I also had Oliver join me as one of the participants to talk about his experience with breath work and meditation. So I hope you've all found that helpful. And then this is the second acupressure talk that I'm doing. On the 15th, I did a talk and I really focused on each of the individual points and some of their effects, functions in the body. So today I want to put together those points into a routine that we can all work on from head to toe. That doesn't mean that you have to do all of them all the time, but this would be an idea of how to do that, and instead of just doing a point, doing a combination of points together to help support the goals. And of course, our goals are continuing to be immune system support and stress management. And for the immune system support piece, it's really about just supporting the immune system to respond as it's supposed to. So we're not trying to boost up the immune system or suppress the immune system. We're trying to help modulate the immune system and help it function in the way that it's intended, and so it can best support us. And then for the stress management piece, we talked about nutrition and these points as well. Not surprisingly, many of the points that I'll talk about today can both have an effect of helping support our immune system and then also are helpful for stress management. So those override each other. And I've talked a lot in the past, and obviously there is a lot of information discussing the fact that stress and unmanaged stress and its ability to affect our health and our immune system overall. So obviously this is a stressful time. So we're all going to have stress, and at times it's going to be easier or harder. But these are all tools to help us integrate, calm our nervous system down, and also help manage some of the physical manifestations of the stress, those places that we hold on to when we tend to be stressed. So I hope that's all helpful. So I'm going to run through that little routine, and then I'll finish up with just a couple of points that would be used more when we are starting to get sick or in the midst of sickness in order to help manage those symptoms. So on the front end, I'm going to be going through a routine that's a general routine for immune system support and stress management. And then I'm just going to review a couple points at the end that I talked about last time that can be particularly used well for symptom management. So just a few things to remember is when we're stimulating these points, there's a variety of ways to stimulate this. So we can do a steady pressure. We can do a sustained pressure with a little bit of a circular movement. Sometimes people like to do tapping, and I'll talk about a couple points in particular that can be helpful, or a little bit of massaging, stimulating. So I encourage people to experiment a little bit and find some ways that might work best for them. For those who can't do it themselves, we talked about trying to have a care provider, and the nice thing about having this recorded is it's a routine that you can review and practice with over time, and I would certainly encourage you to do that if you're able to. This would be a great time to both listen, but also to participate as well and practice along with me if you're able to. We talked about using inanimate objects, blunt objects that we could use to press on points, even pieces of furniture, rounded ends if you don't have the hand mobility, but can maneuver yourself to get to some of these points. The idea is you just want to kind of stimulate the area and get some either pressure or tactile stimulation into that area, and it's going to help, in a sense, activate that point, help get some of that function. Acupuncture can be very effective. I talked a little bit last time about the idea of acupuncture being a stronger stimuli, lasting the system a little bit longer, can kind of affect by a little deeper level. Acupressure can be a very effective tool, but based on all that, needs to be applied a little bit more consistently. So if you're really wanting to use this as one of your tools to support, I try to encourage people to try and do it at least a few times a week. If you can do it more, that's even better. And if there's times that you can't do it as frequently, still work at it. It's still going to give you a benefit, but you're going to get the best benefit by coming back to this and doing this on a somewhat regular basis. So like I said, I'm going to go through all the points with a quick description of the points. So you might decide as I go through this, these are the points that really feel like the points that are most helpful to me, and you could focus on that, or you could break it up into a couple pieces if that's easier. So I would encourage you to work with it a little bit and find ways that's going to work best for you. And as I've mentioned, all my talks, I'm always available if you're having trouble implementing it, or if you're wanting to problem solve a little bit. I'm more than happy to spend a little bit more time one-on-one talking about some of that and giving you some ideas that might work best for your specific situation. And I encourage you to reach out to me. The best way to reach me directly would be through email. And that email address is omstephan1@gmail.com. So omstephan, STEPHEN 1@gmail.com. So I encourage you, if you're able to just kind of settle into a comfortable position. I'm sitting, you could do this laying down, you could do this sitting, you could do this reclining, standing. So really any position that you feel like you're going to be comfortable with, that you can hang out with for a while, it's going to give you access and something that's going to be comfortable for you. So just take a few seconds to just kind of settle in, quiet down, try and bring your attention and focus to what we're doing today. And we're going to start at the head and going to work our way down. So I'm going to ask you to come up to the top. And this is the D20 point that I talked about 2 weeks ago. So this is a really good point for helping us with energy and for mental clarity and focus. And so there's a couple ways that you can find it. It's right at the crown of the head. If you go from the tips of both of your ears and just come straight up, you will also come up to that area. We are all different, but oftentimes if we get in that general area and work with 1 or 2 fingers, we'll find a spot which is where the sutures, the different bones of the skull meet. And so there is a soft spot that's still there. It's usually pretty small, but as best as we can to be centered on that point. So this point is used for uplifting our energy, so it can be used for mood elevation. It's used a lot for mental clarity, so it can be very easy to be distracted at a time like this, to have a lot bouncing around in our head. And this will help settle this down. So it brings good, clear energy. So it's not like a stimulating point necessarily, but it brings an uplift to our energy and a clarity to our mental energy. This is a point that's oftentimes used as part of ADD protocols for that exact purpose and function. So you can see I've just been holding this for a little while. Again, the pressure should be a nice sustained pressure, firm, getting in through the superficial levels, but you're not really digging in. So after holding this for a little bit, another thing that you can do is there's a set of 4 points in the 4 directions around that center point called Shi Shen Kong. And it likewise has a similar point for mental clarity, just being able to be focused and present. And so what we can do for that is I tend to do, and you can do this for that D20 point as well, a gentle tapping just in a circular motion around the crown of the head. And we don't want to be really pounding on the head, but it's just a nice gentle tapping right on the surface. Can be a good way to kind of help get that done. So it's a good starting place, kind of bring us into the moment, make us present, help us support us in that direction. And then the next thing to talk about is Yin Tong. And this is the point right between the brow here. This is a very calming, centering point. Can be really good when we're feeling a little bit out of control, a little overstressed, having a hard time getting a grasp on it. So there's a couple strategies for this point. One is, again, the gentle tapping. right here. What I like to do is actually start at the bridge of the nose and kind of like I'm just gently pinching, but pulling that skin up just a little bit, and I'm not being aggressive with it. And for many of us, especially when we're more stressed, we have things on our mind, we tend to kind of scrunch that up. And I find that working this area really helps loosen this up. It really helps open up. And again, helps give us more clarity and focus, good for tension, also good for calming. I also want to talk, I did not talk much about the ears last time, but I did want to kind of add that in this time because there are some points there that can be particularly helpful for managing stress. So I marked on my ear here, if you can see, so there's a little V here and that little dot right there. And so for this point, this is, I find this to be a particularly strong point for a lot of people, especially in a moment when anxiety is really up, really kind of worked up and agitated, is you can just kind of like hold on to that point. And I use 2 fingers and just kind of squeeze in between those 2 fingers from the front and the back and just kind of hold that for a little bit. And just the breathing stuff that Oliver talked about, or there's been some other breath work from a couple of our practitioners. Those would be things to kind of be including along while we're doing that. So that's Shemen, spirit point, really good for calming us, especially in the moment. And then if we get right up under there, so there's this little wall here, and if we get up under there, that is a kidney point area. And the kidney point is about our, on a psychological level, is about our willpower to get through a difficult time, or push to kind of keep moving forward. So that would be a good point. And then lastly, right at the very bottom part of the ear, are heart and lung points. So right in the center, lower part of that lower part of the ear is a heart point. And again, another good point for just kind of helping calm us down. So I would say those 3 points, basically on that vertical line, would be all points that could also be used, particularly with a focus on stress management and helping us calm down at a moment where we might feel escalated, we're having trouble settle down, focusing, sleeping, all those types of things that can be particularly helpful for. So I'm going to move more to the back of the head now. So if we follow that neck muscle right up to the base of the skull, I talked about that point last time, being gallbladder 20. So this is a point particularly good for relieving stress. The neck, upper back area is an area where a lot of us can hold a lot of stress. And so this would be a good point to be holding and working on. And so basically you just come up the outer part of the neck muscle right to where you get to the skull bone, and it's right in that little curve right there where you can't go up anymore. You're going to turn for the skull. So that can be a really good point. And then if we go from there and we have behind the ear here, and we go halfway in between, there's a soft spot on the back of the skull. And this is a particular point called onmion. And this is a point that's been found particularly helpful for sleep. And that's actually the one real indication for this point is for insomnia. And so you could work from this D20 point and kind of come over and just work along here as another addition. After you stimulate that point, if we come down to the GB20 and then come down the neck to the base of the neck, this is a point that I also find it can be really good for helping relieve chronic neck and upper back tension. So I always stop and spend a little bit of time along there. And then I'll move out to GB21, which I talked about last time, is a trigger point for the trapezius. Most of us will have at least a little knot there. A lot of us will have a bigger knot there. And that will be a good point to help release some of that muscular tension, that holding in the upper back and neck area. The GP20 and 21 point can also be helpful in supporting the immune system more I would think of those more during times of the beginning stage of illness or during illness. The GB20, the back of the head, particularly good for headache, and GB21, good for its descending action, so it can be helpful, while not necessarily primary point for helping with respiratory issues, lung issues, and kind of helping, especially if there's a lot of congestion, tightness, and we're trying to move things down so it's not impacting the chest as much. This would be a great point. I did highlight last time, and I'll say again that this point would be one of the points that is contraindicated during pregnancy because it does have a strong descending action. So again, can kind of help calm us down. And so when we're pregnant, we don't want to move things down too much because that could be a problem. All right, so I'm going to just touch on a couple wrist points that are going to be particularly helpful. So we're going to start on the thumb side, and we're just going to follow down. And there's a tendon right here. We're going to be right inside that tendon right at the wrist crease. So this is lung 9. This is a really good supportive point for lung function, respiratory, immune system support. So this is a good point to use on a regular pace, on a regular frequency to help support our respiratory and immune system function. This also, in combination with the other 2 points that I'm using, can be used together to help with calming and relaxing. So this is a little more focused on the respiratory immune end of things, but certainly can be used for that as well. I'm going to now go to the exact opposite side. And same thing, if we follow, there's the tendon that controls the little finger. And if we just come right inside that, right at the wrist crease, we're going to be on heart 7. And this is a really good point, as I talked about last time, for helping us calm and settle the mind. And so this is kind of more, this point would be, it can be used for the actual physical heart, cardiac issues, but it's really used a lot for more the idea of the emotional heart and kind of helping calm that down. So that would be helpful for that. And then we have pericardium 6. So this is right in the center of the wrist. And if we come down, there's the carpal band that goes around the wrist. If we just come off that tough band right in the center here, we'll be on pericardium 6. This is a great point for nausea, vomiting, rebellious stomach ache that I talked about last time, but it is also connected to the lungs, so it also can have an effect and helpful support for the respiratory system. And these 3 points together can be used for calming the system. There are actually devices that are sold for people that have chronic insomnia that provide a low-level electrical stimulation on these points, and people do feel that it's helpful for helping them get to better and more consistent sleep patterns. So there's basically these triangle of points. There's also the pericardium spot right at the wrist, which would be a point that could also be used more specifically for respiratory and immune support, but it also does have that emotional releasing or relaxing support as well. So I'm more inclined to use these 3, but you could certainly incorporate that one in as well. All right, and now I'm going to come to the core of the body and review some of those points that I talked about last time. So I'm going to start with that lung 1 point. So if we follow the collarbone, the clavicle out to the deltoid muscle. So once we get into that little notch there, that's actually going to be lung 2. And so we're 1 finger down lung 1. I usually just encourage people to use a couple fingers right in that area and just kind of hold that spot. This would be a good spot to use while we're working on some breathing activities as well, really trying to open up the chest, improve our respiratory capacity. Always encouraging people to, we all tend to come forward. It's called protraction. So it's good, especially in general, but particularly when we're working on something to work on a little retraction. So really trying to bring those shoulders back as we can and helping expand the chest area. So again, just kind of hold this for a little bit. Can be really helpful for respiratory function, immune support. Likewise, the kidney 27. So we talked last time, sternal notch right here, right in the center. And we're right off to the side of that. I find rather than using sternal notch is a good guide, but again, I use that collarbone and come until I start to hit the cartilage and bone that starts to form the area connected to the sternum and the chest. And so again, we can just hold one or both of those points at the same time. This is another point good for helping open up the chest, ventilate the chest, good immune system support, good respiratory support overall. So certainly not bad to combine these things as you're able, work on a little breathing stuff as well, and doing what we can. If we can actively bring our chest back, or oftentimes encourage people to roll up a towel, use a small pillow, put it vertically between the shoulder blades and either lay back or lean back into it is another way to more passively get that opening going. So it's lung 1, kidney 27. Now coming down to the center of the chest. So last time I talked about this, Ren 17. And if we just come down right to the center of the chest here, there is going to be a spot that's going to be a little softer cartilage spot, and typically going to be a little bit more tender. So really encourage people, just do some stroking down, find that point. This is a point that can be particularly helpful for, again, helping open up and expand the chest, helping increase respiratory capacity, and also that emotional level for all these points of, this can be an area when we're feeling really stressed that people will feel tightness in the chest, a shortness of breath, and this can certainly be helpful. The lung system in Asian medicine, each of the organ systems have an emotional component, and this one is about grief and getting the processing of our grief and the idea of being able to get it off of our chest. And so this can be a good point to help with some of that emotional release as well. So sometimes that can be a little bit upsetting, and it's not uncommon for people. Sometimes this would be a point that sometimes can bring up some emotions, but also a lot of times people will feel afterwards it helped release some of those emotions. So this would be good both on the physical level as well as that emotional level. And I'm going to now kind of just work some points down the midline. These are our big energy points, much along the idea of the chakras of the body. So if we come down just a little bit and we find that xiphoid process, so that's the tip of the sternum, and then we're going to just come right above that. So where the sternum really ends and the xiphoid process starts, there's a couple points there. So again, I would use a couple fingers, and this is more, so this one's more for the lung, this one's more for the heart. And again, both a physical heart, but also the emotional heart, and kind of a good de-stress point along those lines. And then going to just kind of continue down, and I would encourage you, if you're doing this, to just follow along as you're finding the spots, and so just kind of stimulating down this pathway. So the next spot is going to be Ren 12. I'm just trying to position this so you guys can see a little bit. So if we're on that xiphoid process, again, we're on our navel, this spot is going to be just about halfway in between. And it is a spot that if we kind of move and bend a little bit, either actively or passively, it is right at the border or the boundaries between the rectus abdominis muscle. So it's at a little seam there, right there. And this is a really good point for our digestive energy. Talked a lot both in the nutrition talks, lifestyle talks, as well as the acupressure talks about the real importance of good digestive function and supporting our immune system and helping manage that. And just like our lungs, really any of our systems can be affected by stress, but the gut is often an area where that can happen. So it's going to help support good digestive energy, and therefore also help support the digestive energy being the mother of the immune system, so to speak, the nurturer of the immune system. Help that all function a little bit better. And then we continue down below the navel, and then there's a spot immediately below the navel. So it would be about the distance of the tip of your index finger, your pointer finger, to that second knuckle. So from here to here. So if we use that as a measurement going below. And so down here, there are energy points, there are kidney and bladder points. So what I would be encouraging you to do at that point would just be to be working from the navel and just working down towards the pubic bone. And you could stop at individual points along the way, or just do like a nice slow steady stroke in. Maybe do that 4 or 5 times, just working this whole area. So I've touched on before, the kidney system in Asian medicine is really the foundation upon which everything rests. It's the source and the first system that really develops. And so that is the foundation upon which everything else rests. And I talked about on the emotional level, this is the kidney energy is really about kind of the will, the ability to kind of see things through, especially during times of challenge. Some other things on the abdomen that I like, this is really good, especially more in a relaxed position. So sometimes, a lot of times I will recommend if people are gonna do this, if they're holding a lot in the diaphragm, not really getting that good full breath, getting the diaphragm engaged. So we can start at the midline and just work along the boundary of our rib cage as we're going down. So a lot of times what I would recommend is being on your back, legs up a little bit, so all of this is relaxed and you can just kind of get in there and work and relax that. And then last time I talked about this liver 13 point. So this is a good point for, again, helping relieve stress, especially when it's impacting on our stomach. So low appetite, loose stool, just an unsettled feeling in the stomach. And so what I like to do for this one is find the bottom of that rib cage, using the back or the palms of our hands and just kind of brushing down along this area. So this combined with this can really disperse a lot of holding and congestion in the middle of the body. Yeah, right. And I'm gonna move down to the legs now. Not too much clear there. So, stomach 36, and again, a very important point, one of my favorite points, very, very nourishing point. Really good for energy, good for blood support, good for our immune system. It's a point that's been studied a fair amount. Some of the research I'm most familiar with is its use with patients that are undergoing cancer treatment, and that consistent stimulation of this point was responsible for an improvement in blood counts, energy, and was just overall supportive in that way. So certainly this is a good point to be stimulating on a regular basis. And so the location, if we go through hand width, so 4 fingers below the outside corner, lower corner of our knee, and use that. Again, I find a lot of times I like to use bones as a source, so I'll come up the outside of the big bone, the tibia, and just as we get to the point where it starts to curve would be that point. Again, I didn't say this on the front end, I did last time, but the points are usually places where there's creases, borders. This is a very soft spot surrounded by a lot of muscle and tendons. So it's the one squishy spot in there. This is a spot that actually can really benefit from some heat being applied directly. So traditionally moxa would be used, but really using any kind of gentle heat source in this spot would be really not a bad thing to do. In Asian culture, it was really encouraged for people to use this point, especially as they got to middle ages, older, because of its just support for good health, energetic support, kind of keeping us strong as we go through time. All right. And with this being such a nurturing point, it's also a very grounding point. So if we're feeling distress, kind of out of sorts and kind of just all over the place and ungrounded. This point's really helpful physically, but can also be helpful in that respect. So I'm going to just do a couple more points on the lower body. So spleen 6, another one of my favorite points. We go from the inside ankle bone, the tip of the malleoli, that bone that sticks out on the side. We use a hand width up. We find that tibia bone again, and we just slide off of it, that hand width above. I find this to be a very grounding and settling point for a lot of people. It's a very nourishing point as well. It is a crossing point, so it means spleen, liver, and kidney systems all cross at this point, and those spleen, liver, and kidney, I already talked about the kidney, but then the liver and spleen after that are really the foundational basis for good function of the rest of the system. So this is a very nourishing point. It's particularly nourishing of the yin, the substance of the body, the structures and the things that we can see, and particularly the nourishing fluids of the body. And then likewise, kidney 3, which is directly behind the ankle bone, right in front of the Achilles tendon, has a similar effect of its nourishing capacity, especially for that yin aspect. And so yin is about structure and yang is more about function. So the things that we can see that are supportive versus the actual functional activity. So the yin always supports the yang. We need to have good yin in order to support that. That yin is really helpful and supportive of the immune system. And again, these points on the lower body are particularly good for helping ground us and settle us during times of distress. Right, and now just a couple more points on the feet. So, just talked about spleen 6, which was a little bit above the ankle bone. I'm going to talk about spleen 3. So if we're on that big toe, we find that big joint. Spleen 2 is on the toe side, spleen 3 is on the foot side, and it's right on the line that separates the top from the bottom of the foot. So this is another very nourishing point. I like the combination of stomach 36 up by the knee and spleen 3 for blood support, also helpful for immune support. This is a really good point that helps the blood, helps us do better with absorbing the nutrients from our food. And then liver 3. So if we just come between the first and second toe here in the forefoot, right before that meets, there's that separation between the bones there. And so liver 2 is right by the web space, liver 3 is up a little bit higher. So you can really stimulate both of these. Liver 3 we talked about last time in combination with the large intestine 4 as a treatment called the 4 gates. So another good thing for stress, and especially that physical opening, the idea of opening things up, getting things moving, that stuffiness out. So that would be good in that respect. Last one that I think I talked about last time, but I really wanted to emphasize is kidney 1. So if we come from our middle toe, we come off the ball of the foot and we're going to fall right into the center there. This is a particularly really good grounding point. So we talked about D20 at the top of the head, kidney 1 at the bottom of the foot. I've had a lot of success over the years having people use this point consistently during times of high stress, distress, whether it be physical, emotional. So a lot of my oncology patients that are not sleeping well, people having a lot of heat symptoms, irritability, restlessness, just a lot of emotional distress, really getting into holding that point on the bottom of the foot, especially before bedtime. People find that after just a couple of days of doing that consistently, that there is definitely an improvement in those issues that I just talked about. So that finger pressure is particularly helpful, but I do encourage people, if you've done it a few times and find it's helpful, it can be good just for a few seconds to get in there and again stimulate that point at the bottom of the foot. But then you could, after you kind of get things going, You could use something like a tennis ball, a racquetball, something along those lines, and just put it on the floor somewhere where you can just kind of work it back and forth into that area. And that can be another way to help support and stimulate that point in a way that's going to be helpful and supportive. And again, really tends to have a calming effect. So I'm going to just do a quick review, and then I'll finish up by just talking about 5 or 6 points that can be helpful if we are starting to feel ill in particular. So you start crown of the head, D20, and then that little circle around the crown of the head to kind of help support that. Yin Tong kind of coming down here, helping stimulate that. The ear points that we talked about, 1, 2, and 3. Back of the head, GB20, off to the side, Amion for sleep, GB21 for helping the body relax, helping bring all this down a little bit. The 3 points at the wrist, all supportive for lung, heart, pericardium point. A lot of this has to do with digestion, but also does have a secondary lung supportive role as well. And these 3 points together, also helpful for sleep and relaxation. Lung 1, kidney 27, Ren 17, and then those points going down the midline. The rib cage work and brushing along the sides. And then the points down the leg that I just reviewed. So that would be a nice flow, especially helpful if we're feeling more unsettled, disrupted, stressed, irritable, bringing the energy from here and just slowly bringing it down and kind of rooting it into the body, while at the same time dispersing that physical holding of stress in our body, which makes us feel more uncomfortable and also puts more stress on our immune system. So I'm going to just wrap up with a couple additional points for active symptoms. Talked about these last time as well, but thought I would just review them again. So lung 1 would be fine and good to use during a time of acute stress. Talked about last time, right on the inside of the elbow crease. We flex that. If we're looking at the palm of the hand as we do that, that would be the radial side. So we find that biceps tendon, and then we just roll off of that into the crease. This is a really good point for cough, clearing phlegm, helping open up and ventilating the lungs as well. And then lung 7. So we talked about lung 9 as a nice nourishing point right at the wrist crease. And then lung 7, which is right off the styloid process. So we have this bone that sticks up on the side of just proximal to our wrist. And if we come just above that, and this is one of the points I like to pull up and pinch, this is a great point to use when we're trying to fight off any kind of respiratory infection. And again, I find I like to stimulate this by just kind of grabbing that skin, getting to that cellular process, and then picking up the skin and just kind of working along that line a little bit. And then lung 10. So lung 10 was the spot on the outside of the thumb. So if we go from the thumb joint and then the rest, and we're halfway in between, I find for a lot of people it's just easier to just work along this bone. But if you're right in the midline here, and this is a point particularly good for the throat. So any kind of throat issues related to acute illness, but just in general, this is a very good point for helping address that. Talked about large intestine 4. So that was the spot that if we basically put our hand like this, we're going to have that high spot. And then if we just open up, we're in that web space, but we're pushing more towards this index finger here. This is a really good point for facial symptoms, for opening things up in the head. So frontal headache, nasal sinus, ear congestion, any kind of issues with the face area, this is really helpful for. And then large intestine 11, you can see the end of my elbow crease here, the bones here. and it's going to be in that soft spot right in between the end of the crease and the bony area. Large intestine 4, large intestine 11, both really good for helping stimulate the immune system response. Large intestine 11 actually can help bring down fever if we're needing to do that. And then lastly, there are some points on our face. If we are having some congestion in the face, some of the most prevalent ones are right the end of our brows and right at the eye orbit. There's typically a little crevice in there, and it's actually an area where things drain. And so by just stimulating things, we can open stuff up there. Similarly, if we come on the lower end of the orbit of the eye, this can kind of help relieve some of the pressure in here. And if we follow this little fold here, right, even with the end of the nose, this is particularly good for helping open up the nose. That being said, sometimes if people are having a lot of eye pain or irritation, we can follow on the socket of the eye if we're finding some tenderness. Those would be areas to work on as well. And then also, there's a spot behind the ear if we're feeling a little more congestion and pressure in the ear. We kind of get right behind the earlobe there, hold some pressure, and then kind of bring that down, and that will kind of help drain some of that out. So that's a rundown of some of the things that we can use proactively. We want to try and do it again. It's best to try and do it on a somewhat consistent basis. 2 to 3 times a week would be great. If you can't manage that much but can still do it, certainly still going to be helpful and supportive. Again, I would encourage you to watch the video, kind of review along, and hopefully you can get to the point where you can get more comfortable just doing it on your own. And I would encourage you, if you have any questions, concerns, clarifications about anything we talked about today, please do check in and let me know. I'd be more than happy to answer those questions. So signing off, I hope you all stay well. I hope you're reaching out to those in your community, trying to keep those connections going, kind of keep nourishing yourself physically, mentally, emotionally. And again, don't hesitate to reach out to any of us at the Chanda Center if you're needing some support around those issues. Thanks for watching and looking forward to seeing you all soon.